Medical psychology is the application of psychological principles to the practice of medicine for both physical and mental disorders. The American Society for the Advancement of Pharmacotherapy defines medical psychology as a branch of psychology that integrates somatic and psychotherapeutic modalities into the management of mental illness and emotional, cognitive, behavioral and substance use disorders. A medical psychologist who holds prescriptive authority for specific psychiatric medications and other pharmaceutical drugs must first obtain specific qualifications in psychopharmacology. A trained medical psychologist is equated with a mid-level provider who has the authority to prescribe psychotropic medications such as antidepressants for neurotic disorders. However, a medical psychologist does not automatically equate with a psychologist who has the authority to prescribe medication. In fact, most medical psychologists do not prescribe medication and do not have the authority to do so. Medical psychologists apply psychological theories, scientific psychological findings, and techniques of psychotherapy, behavior modification, cognitive, interpersonal, family, and lifestyle therapy to improve the psychological and physical health of the patient. Psychologists with postdoctoral specialty training as medical psychologists are the practitioners with refined skills in clinical psychology, health psychology, behavioral medicine, psychopharmacology, and medical science. Highly qualified and postgraduate specialized doctors are trained for service in primary care centers, hospitals, residential care centers, and long-term care facilities, and in multidisciplinary collaboration and team treatment. The field of medical psychology includes the specialties of health psychology, rehabilitation psychology, pediatric psychology, neuropsychology, and clinical psychopharmacology, as well as subspecialties in pain management, primary care psychology, and hospital-based or medical school-based psychology. The term medical psychology is an umbrella term. It encompasses the multiple specialties that make up healthcare psychology, embracing the biopsychosocial paradigm, Engel, 1977, of mental/physical health and extending that paradigm to clinical practice through research and the application of evidence-based diagnostic and treatment procedures. Adopting the biopsychosocial paradigm, the field of medical psychology has recognized the Cartesian assumption that the body and mind are separate entities is inadequate, representing as it is an arbitrary dichotomy that works to the detriment of healthcare. The biopsychosocial approach reflects the concept that the psychology of an individual cannot be understood without reference to that individual's social environment. For the medical psychologist, the medical model of disease cannot in itself explain complex health concerns any more than a strict psychosocial Levine and Orabona Foster, 2010, explanation of mental and physical health can in itself be comprehensive. Medical psychologists are trained and equipped to modify physical disease states and the actual cytoarchitecture and functioning of the central nervous and related systems using psychological and pharmacological techniques when allowed by statute, and to provide prevention for the progression of disease having to do with poor personal and lifestyle choices and conceptualization, behavioral patterns, and chronic exposure to the effects of negative thinking, choosing, attitudes, and negative contexts. The specialties that constitute medical psychology strive to integrate the major components of an individual's psychological, biological, and social functioning and are designed to contribute to that person's well-being in a way that respects the natural interface among these components. The whole is greater than the sum of its parts when it comes to providing comprehensive and sensible behavioral health care.